Hi, this is Dr. Eric Thomas. I wanted to talk briefly about a pretty common condition often seen. Well, it could occur in people of all ages, but often it's in school and sometimes it runs in little mini epidemics. It's a bacterial infection that often produces crusting. Sometimes it's a honey-colored crust, and there's also a variation that produces blisters. But in any event, it's caused by a bacteria called Staphylococcus aureus, pretty easily spread through kids touching one another and so forth. It is contagious. Good hand washing is important, or use of a good alcohol-containing hand gel of some form or the other. Really important that kids not, pass pencils and all that around more than they have to. So where does it occur? Well, I've seen it all over, but characteristic areas are around the face, corners of the mouth, honey-colored crust traditionally. In the old days, before we had bacteria antibiotics, people would use all sorts of folk remedies. And I remember one child who came in whose parents had put a home remedy from the old country on. I don't think it worked too well, but it had a bluish green tint. It was sort of running. It was a little disgusting. But in the old days, gentian violet, which is a bluish dye, was apparently used with some degree of success. Nowadays, the ideal thing is to get a bacterial culture. It doesn't hurt. The reason, well, most staff is uneducated, hasn't gone to school, hasn't been exposed to too many antibiotics. But you've certainly heard the term MRSA, methicillin-resistant Staph aureus, and that's a little harder to treat, and the antibiotics that might normally be used to treat the oral systemic ones that might normally be used to treat ordinary impetigo wouldn't work if it was a Staph aureus that had gone to school. By that I mean if it had been exposed to a lot of antibiotics and was resistant. So that's what all that MRSA is a Staph aureus infection that has become resistant because it's been exposed. Not a lot to say except if there's crusting, it should be checked out. Also, there is a fairly good instance of people carrying, without knowing it, staph. Usually it's in the very distal, very end of the breathing passages, the nostrils. So I'm not going to get into that too much here, but to say that your doctor might want to, in addition to culturing the rash itself, they might want to order a bacterial culture to see if you're a staph carrier, because if you are, there are some special ointments that can be used, which again is something best recommended by your healthcare provider. So there you go. It's a very common condition. It's one that causes a lot of upset, especially if it runs through a school. Now adults get it also, and one of the interesting conditions that I saw, I've already mentioned that you could get blisters, but I have seen one child who just had little small blisters on an area of the body that really did not have the crusting. So this is a staph that has an enzyme or chemical that causes the outer layer of skin to split a bit. By the way, I should not fail to recognize that there's another bacteria, strep pyogenes, that also can produce the crusty, honey-colored one. The blistered one is most likely the Staph aureus. Not trying to turn you into a bacteriologist here, but it's nice to know some of the jargon if and when you have to take your family or yourself to a doctor's office. I'd also have to say that cultures are pretty useful. Some people don't like doing them. They think they don't need them, and that's their judgment. I respect it, but I'll say that I've found a lot of infections that might not seem obvious in the face of it. Also, bacterial infection, although it may not be the primary cause, can can be an opportunistic growth on top of, for example, atopic eczema. And a lot of kids with eczema really won't clear up unless underlying causes, whether it be infection or whether it be a hidden allergic reaction, is cleared up. And I think I'll link our patch test talk to the end of this, because that's something that's really very useful in children with eczema. So in any event, thanks for listening, and hope that was a little bit to clear up terms MRSA, Impetigo, and so forth. Best wishes.